Okay, so I think we should start. We should not wait much. So,
For
guys,
sure.
good evening and welcome you all to the leadership program and leadership dialogues. This is the fourth edition of leadership dialogue, and today we have with us Dr. Priyansh. Shah. So, before his introduction, I would like to tell you a story. Last year, somewhere when the pandemic was starting in 2020 April, so we all went home due to the lockdown. And one day I got a call from Devers. Devers is our vice president of finance. Okay, so like he contacted me, like we are starting. Uh, World Youth Heart Federation. There is a federation and a non-profit organization to work on the cardiovascular problems. I was really excited because this is my main domain of research and work, and I did my PhD in that domain only. So I was very excited. And when we have started, we had in the executive board we had a few people, 10 or 15 people, and now in a 1 year of span, when I look at the WYHF, today we have thousands of volunteers and more than 200 of organizing committee. I mean, organizing people who are organizing WYHF all over India, and we are expanding it to worldwide. So that's how we have, we did a great growth in last 1 year, and now we have approached, all the states in India, all the major cities. Recently, our COVID COVID relief we have donated the things. We have helped in 55, more than 55 major cities in India, and every day you are seeing in our Instagram pages that how we are doing. So it all has came from the brain of Priyansh Shah. So welcome, Dr. Priyansh.
Thank you so much. And this actually gave me goosebumps, the story of how we grew from, just
Yeah, exactly.
10 people to thousands of people right now. It's
True.
actually amazing when we look back at it, for sure. And it's just like thinking of it is just one part, but executing it, the teamwork, having the team who can execute all of this is the main thing I'd say.
Yes, true. So let me introduce Priyansh now. Priyansh Saha is an aspiring global cardiothoracic surgeon and a social entrepreneur. He is currently intern doctor at Baroda Medical College, India. He is the founder and president of our WYHF, World Youth Heart Federation, a social enterprises. It is the first youth-led organization in the world that tackles a targeted healthcare problems by intersectoral and ecosystem approach. He is currently a global surgery research fellow at WHOCC for the research in surgical care delivery in LMIC. His work in global health began in 2018 when he was elected as the National Officer for Public Health at the Medical Students Association of India, MSAI. They conducted over 10 national public health campaigns and reached out to more than 23,000 people. His journey with global surgery and incision started in 2019 when he became a part of the international fundraising team. Currently, he is working as the vice president for finance at Incision. He believes that health financing is not only a major building block of UHC, but it is indispensable aspect of global surgery. In the creative world, he has been the chief organizer and licensee for TEDx MS University of Baroda. He has acted in large number of plays, so he's an actor as well. He's an actor as well, and he has taken part in multiple plays in the school and colleges. So welcome, Priyans, to the leadership dialogues.
Thank you so much for such a humble welcome, and thank you so much for inviting me here. It's a pleasure to be here.
So I will start with my first question. This will be a totally, discussion part, and you are welcome to ask any questions in between if you have, and anyone can, ask the questions. Anyone can come in between and talk to us. And so I'll start with my first question. So tell me the inspiration behind WIHF and how it has started. How we came up with the WIHF, Priyans.
For sure. So this story is, I'd say, just like everyone else, I'd say each one of us has that one thing that they really want to do. So, you've mentioned that I've worked in public health and I've worked in a lot of organizations in the past. So, and I belong to a business family and I'm pursuing medicine. So I always had that social entrepreneurial area in my head where I wanted to work on. I worked on a few startups early on, but most of them were directed towards a social impact area. So I knew that was my calling. And after that, I really wanted to work on intersectoral collaboration. So in the past, I've worked with a lot of medical students and junior doctors, but while I organized TEDx, I got a chance to work with all the students of my university. And that made me realize that as we move ahead in the career, when we're in college, we're in a very protected environment, just like school. We're just interacting with the people of our field, and we're not exploring and we're not learning about new perspectives. So that made me understand that how important intersectoral collaboration is. And everyone would agree that we cannot build something alone. Like if people from one field started working on something, they would never be able to achieve what their goal is. But when brains come in from different perspectives, that is when magic happens. So these were the thoughts which were moving ahead, and then the focus, which is cardiovascular health. So, as a lot of Indians, both my grandparents passed away because of a heart attack. So, I have family history of cardiovascular diseases. So that area ran strong in my head, and I was always interested in cardiovascular health. So, over and adding on to that, the burden of cardiovascular disease is so high in India. Almost 4 people have a cardiovascular health problem. So this probably got together to create the perfect mix, which is WYHF. And I just penned down the idea and I just thought of it that, maybe someday we'll do something like this. I don't know, because I was in my final year of MBBS, and uh, as a lot of you might know, it's very hectic during that time, and it's next to impossible to do anything except study during that time. But then COVID happened, so all of us were pushed home, and then I got time to actually pen it down and work on the idea. And that is when Dr. Ajit's story comes in. So after that, I contacted a few of my local friends, a few of my organizational friends that, this is something which I have in mind. What do you think? So I had been, brainstorming about this, and I'd been formulating this plan for a couple of years, I'd say. I would add something, subtract something, and finally this came into picture. So I just pitched it to a few of my close friends and then to a larger circle, and then to my surprise, a lot of people found that it was interesting, and then we started expanding and getting more people in. And 1 year from that, here we are. In fact, on 22nd July, we'll officially complete 1 year of
Yes.
being a registered NGO. So that also will be a benchmark. And in the past year, we've been able to work on a lot of areas. We've organized our annual conference, Heartbeat, wherein we took a lot of new sessions like biodesign in cardiovascular health. So that was the first biodesign session, which particularly focused on cardiovascular health. And we had research protocol writing, we had, policy writing, and a lot of other areas. And recently we worked on COVID relief. So for COVID relief, we've been able to reach out to more than 3.8 lakh patients and over 18,000 frontline workers. So that's a huge impact that we've made in a span of 2 months. And like, as Dr. Ajit said, that wouldn't be possible without all the local heroes that we have. Uh, here we empowered people to take lead locally and help their own community with a structured plan. So, that is how we started, and just little
Yes.
by little, here we are.
So, guys, we have five committees in WYHF. Okay. Actually, it belongs to the word heart. So, Priyansh, would you like to enlighten those five committees, what we have, established from starting?
Sure. Sure, sure. So this was a part of the original pitch that we'd come up with, and the committees go with the acronym of HEART. So H stands for health education, E stands for entrepreneurship, A stands for advocacy, R for research, and T for technology. And with time, we've so this was just something that we thought that this mix might be interesting, because we've worked with organizations which are solely working on advocacy, solely working on research, and some solely working on entrepreneurship. But there were very few who had this amalgamation of all the committees in one. And with time, we've realized that how interconnected each of these committees are, and how easy our work becomes when we have professionals from each of these committees, so that all of us can come together and brainstorm on projects. Like, I'm sure in some time we'll talk more about what projects we're doing, and
Yes.
how this amalgamation helps all of us.
Yes, so
So
guys, yeah, it needs a lot of planning before, going to the entrepreneurship, and, if you have an idea, before, going to execute that idea, you need a lot of brainstorming, a lot of things you have to do, a lot of plannings, a lot of, networking, and many things you need to do before, starting any idea. So yes, my next question is on that only. So now, what is the status of WYHF at national and international level, Dr. Priyansh?
currently, WHF, we started off with India as a pilot, because we don't want to go global before we know how the functioning is, how the working is in one country. So we started off with the India chapter last year, and now in a year we believe that the India chapter is stable and sustainable in the near future. So right now we are there in all 28 states. We have over 1,000 volunteers and outreach of over 10,000 people in India. And this is something that we've been able to capture in just a year. And it's actually very beautiful to see how motivated people are, not just in India, but across the world, on working for cardiovascular health. So up till now, we've received. Uh, I've worked in the past with a lot of international colleagues in the other organizations. So a lot of people have reached out to us saying that they'd like to start it in their country, but we haven't started it. We haven't gone ahead with it up till now, because we were just waiting for the right time. But in the next 6 months, we plan that we would be expanding to 6 or 7 more countries, which most possibly would be Colombia, USA, UK, Egypt, Nigeria, uh, Pakistan, and yeah, maybe Indonesia. So these are a few countries where people are already enthusiastic about this project, and they've already reached out to us. So once we have a set protocol, and once the project here becomes sustainable, we would be expanding it to these countries. And once we are able to work on more countries, then so here, if you would have noticed, we would be touching on each WHO region of the world. So that again would be a pilot, that how people are accepting this organization in each region, and what are the uh, problems that they're facing, what are the new things that they're finding out there, because the burden of cardiovascular disease is extremely high in Southeast Asia, but it's definitely very high in other regions as well. So this model can be directly extrapolated to all these areas. And with the idea of one initial pilot in each WHO region, we then slowly expand to other countries. So probably 1 year from now, we'll have, we'll be a truly international organization with around 20 to 25
Exactly.
countries. So,
Exactly.
and that would
And
also
I remember,
give
yes,
chance to all the people here to interact.
I remember, last time on, I think on World Heart Day, World Heart Federation has contacted us to, collaborate.
Yes, that was huge. So,
Yeah,
just 6 months into the founding, the World Heart Federation
exactly.
asked us to, join them. So we are definitely gaining the international traction as well. And
True.
we recently, WHF got featured in Forbes India, which was again a huge milestone for all of us. So the work
Yeah.
that has been done is
So,
amazing.
Priyansh, my next question would be very interesting for the students and for our colleagues who are joining us today. How do you manage everything together? You are, you are in the final years and you are just graduated, and you are working in the hospital, and you are handling the 5 committees of WYHF, many other additional works like ECG expense and all. We are going to discuss later, but those things are also, we have. In our pocket, in our basket to go ahead with. So how do you handle everything and how do you manage everything?
So that's actually a very good question and very pertinent to today's times that we're in. And it's not just so there's WHF, there's internship, which was extremely hectic for the past 3 months because of COVID. Now it's become a little more laxed. We get a day off on Sunday, which is amazing. But internship, then we have WHF, then there are a few research projects which are going on, from the surgery aspect. And all of those little things are a few other commitments. So I'd say it's not easy to manage time, and I'd be lying if I'd say that, I'm able to manage time perfectly well and I have my days extremely organized. So, what I'd say to this is there are ups and downs. There are times because the work that we do involves uh, a lot of your brain work. So it's not just manual work that you just sit down for 16 hours and just keep doing something manually. That might be easy, but here you have to have your focus. You have to have your attention at each time. So the one thing which the few things which I do, which probably help me manage time, is making time blocks and planning my day every day. So it is literally one day at a time. So either before sleeping or by when I wake up, I just plan that these are the things which I want to do during the day, and it might be really amazing if I'm able to complete all of these things.
Yes.
So because it is so dynamic that your schedule changes every day. Because if my internship, sometimes I have my night shifts, sometimes I have morning, sometimes it's evening. So I don't have a regular schedule that I can make time slots that from 4 to 5 I'm going to do this, from 5 to 6 I'm going to do this. uh, and I have started to realize that this actually works better. That I know I have this task would take me, let's say, 2 hours. I have this another task which would take me 1 hour. So whenever I come back from duty and I have 1 hour to spare before some meeting or before something else, then I do the task which was the 1 hour one. So 1 hour task. So it's kind of making blocks of time, that in this block of time I can do this, and in that block of time I can do that. But again, I'd like to mention that it doesn't work, or it doesn't always work. Sometimes you're just not in the mood, sometimes you cannot work. So sometimes you have to compulsorily take a day off, or you have to compulsorily have time to relax and be with yourself and just stop working. Because uh, you might this is something that all of you might have noticed, that when you're working extremely hard for the entire week, you're pulling off 14 hours or 16 hours all week, then probably that week might just go very well. But after that, burnout starts coming in really quickly. And I'm saying this out of experience. I've also had those
Oh,
16 hours days, 18-hour days, and extremely long days where I haven't been able to sleep. Those days were well, but the burnout which comes after that, it's extremely hard. So here, what you probably have to do is you have to manage time slowly, and take one day at a time, and don't compare with people that sometimes you might see when we're students. We often see that when we're studying or when we're doing some work, some of our colleagues are able to do some work in 1 2 hours. It takes you 3 hours. That's all right. The intensity with which you're working, the attention that you're giving is different. So everyone has a different pace, everyone has different time management, uh, I'd say, mantras. But what you guys could do is, take some snippets from everyone and see what's best. So I think Dr. Ajit also has an extremely busy schedule. So, he also
yes.
might be able to enlighten us in this area. And it's
No,
all a learning process. Even I'm still learning on how to manage time better. So
no,
would love to hear
definitely.
from you. Yeah.
Yes. So see, for last almost 13 months, I haven't been home. I'm in Manipal. For last 13 months, I haven't met, my mom. We are just video calling every day, twice or thrice, but I haven't met her personally. So, like there is no time. See, I have joined ICMR 3 months back, 4 months back in March. So that also the office work and all that is right now from the home, but that has some 4 to 5 hours work per day. And then a little bit work for WYHF and the whole day for CliMed. And there are certain other things are going on in life. So lot of things it makes definite burnout after the weeks, and my days are, I mean, no day which is less than 16 hours. 16 to 18 hours every day I have to spend. Then only, I try to finish out all the work. Or if not, then, it doesn't give me the good sleep, frankly, if I say. It says like, okay, burden. And right now, if I say I'm the best example for procrastination, people give me the work and I say, okay, I'll do it tomorrow. I'll do it tomorrow. And it goes long. Seriously, it goes long because there is no, sometimes there is no time slots, and I cannot say no to everyone as well, because some tasks are really important, and then before we have to give the priorities. So in that case, I would enlighten this first blocking system, day blocking system, hours blocking system is very important. If you really see, I have the diary with me, you won't believe. I have the diary with me. I was actually writing the questions, I mean, to ask Priyansh, but I will show you how I use this. See, these are the daily schedules for the 6th, for the 7th, for the 8th. They are the daily schedules. You have to maintain your schedule. You have to maintain your timings. You have to maintain your hours. Daily blocking system is really important. Okay. And if you have the long term things also, that as well works. So, right. See, I know that I have to take 5 classes in this month, so I have to block that time. I have to plan my travel. I have to plan my office accordingly. And then then you can go ahead nicely, smoothly. But still, it gives you burnout at the end. And my Sundays are really hell bitchy. Sundays, sometimes, everyone takes like, okay, Sundays are good and we don't work on Sundays. But frankly, if I say, my Mondays are my Sundays. I take a little off on Mondays, but not on Sundays. And other than that, I'll tell you how to manage your work. You can give the priority. See, in a day you may have 20 works or 20 to 25 works, but you have to prioritize. Okay, maybe based on the deadline, maybe based on the the importance of the work or relevance of the work. It is very important to prioritize your work. Otherwise, your things will not go smooth, guys. So these two things what I even follow, like first is prioritizing your work and second is blocking system. See, you have to maintain that system, otherwise you will mess everything. If you don't have proper planning about the works, about the hours, about the day, then it will mess, Right. So yeah. So next question, I was about to ask. So what are the upcoming plans in WIHF, Priyansh?
For sure. So I'd say this is the most exciting part, and
Yeah.
the upcoming plans are huge. Just to give a little background, I'd say that in the past couple of months, as we just briefly touched upon COVID relief, we were working on COVID relief under the project name of Local Heroes Project, where we worked on three areas, which are needs assessment, supplies management, and fundraising. So here we implemented a different strategy where we ensured that the fundraising takes place locally. Because what we observed during the pandemic is that a lot of people are willing to help their own communities, and no one else can understand the actual requirements of that particular city or a particular hospital or healthcare center better than the people who are working there. And if people who want to donate, they go and ask the people, the superintendents or the deans of the colleges or hospitals about what are the requirements, and they donate based on the prices, based on what is easily available, and not with the actual requirement. Because when you get a list of requirements from a hospital, those requirements are quite lengthy, and they include, during COVID, they included everything from adult diapers to medicines like heparin, which is a blood thinner. So here you had to prioritize based on your knowledge that what is more important. So with this structure, we were able to reach out to those many people. And now what we've realized that require we would require to strengthen the rural healthcare system in the upcoming future. So that is why we've started working on rural healthcare strengthening under the project name of Cardiogram. So in Cardiogram, we're planning to deploy ECG machines across all the rural PHCs in India. And we've started off with a pilot project here in Gujarat, in Anand. We've divided it into three stages. So the first part is having a training session. So we've already gone to those rural PHCs with the digital ECG machines. So the ECG machines that we're deploying are digital ones, uh, which don't print the ECG, but they already have the ECG on the mobile phone, which can later be sent to cardiologists and medicine residents via WhatsApp and ensure proper transmission of the ECG and also immediate diagnosis. So the first step, as I mentioned, was training them. So there we went and we informed them about the project, what we're doing, which I'll briefly touch upon. Then how does a digital ECG machine work? Because it's actually fascinating that these PHCs cater to, so the PHCs that we're first working on have a population of 50,000 under them. Usually PHCs have 20 to 30,000 population under them. But the three initial PHCs, all of them have 50,000 population under them, and five, which are five villages. वो सब के अंदर we just have one PHC which doesn't even have an ECG machine.
Exactly.
How can we expect a person who comes with chest pain to how can we expect the medical officers there to diagnose that this possibly could be an MI, heart attack, uh, which is not possible without seeing the ST elevation? How can we identify the chronic diseases, and how can we identify arrhythmias? Because the symptoms that the patient presents with are very generalized, and the differential diagnoses are large. Like the patient comes with chest pain. A lot of people give medicine for for acidity and send them home, and later you find out that the person actually had an MI and passed away. There have been cases where the person just presents with palpitations and breathlessness. And how can we diagnose these patients without having proper diagnostic tools? So that was the idea behind it. And COVID kind of paved way towards it, because the you know the problem, I'd not say the problem, but the requirements of the rural healthcare system were highlighted. And we were enlightened that how much impact we can make with just one ECG machine. Imagine one ECG machine deployed in a PHC of 50,000 people. As we discussed earlier, a 1 in 4 person in India dies of a cardiovascular disease. So, isme almost over 12,000 people, according to the stats, might, let's just consider that they might just have comorbidities and cardiovascular health problems. It just could be hypertension. But that is a huge population which can be catered by just a single ECG machine, along with various other things like a BP monitor and all of those things, which are already present there. So the impact that this will have on the rural healthcare system is huge, and we probably would be able to save a lot of lives with this project in the near future. So this was a background, and coming back to the phases. So as I mentioned, the first part was a training phase. The second one is a screening camp. So once the medical officers there are trained and they know the importance of these ECG machines, then we organize a screening camp wherein we call in people above the age of 30 years for an NCD screening camp, non-communicable diseases screening camp, where we include diabetes and cardiovascular diseases. So here we're able to identify people with, where the disease was masked, or just providing a general follow-up to people. Most of them would be getting an ECG done for the first time in their life in these screening camps. So these screening camps would also give the medical officer there and also the head nurses more experience in taking ECGs. And the third part would be integrating it with telemedicine. So once the machine is there, then we have a group of people, cardiologists, medicine residents, who are working at their hospitals, but they're available over WhatsApp. So as soon as an ECG comes, they send it to the WhatsApp group, and a cardiologist or a medicine resident is able to diagnose and provide the immediate next steps. So this would not be a place for treatment, but just triaging, wherein the residents are just able to give immediate steps. For example, if the person has a very acute condition, then what would be the drugs that we should give them? What could be the immediate next steps? Which should be the center that they should rush to? Because we've seen this that a lot of time. So a tertiary care hospital in Vadodara, it doesn't have a cath lab. So doing an intervention might not be possible in the government setup. There are definitely private hospitals which do it, but most people from the rural areas are not able to afford it. So we also have to give them appropriate referral, which will save them time and probably their life. So that would be the telemedicine integration part.
Exactly.
And with this, implementing it across India, we would be saving millions of lives in just a span of a year. So with the pilot project that we've started in Anand, we are going to deploy 3 ECG machines in the upcoming weeks in this district. So currently we're in a phase of validation. Most of we're seeing different ECG machines. We're testing how that we are correlating the ECG with the standard ECG readings and seeing which ECG machine is superior, because most of them claim that their machine is the best in their pitches. So we have to have real on-ground validation for all of those machines before we mass deploy these machines. So before starting this, we did a baseline study, baseline assessment for the requirement, and the results that we found out were quite amusing. So we did a baseline assessment for 100 PHCs in Gujarat, and out of those 100 PHCs, only 2 PHCs had ECG machines and X-ray machines at their places. Out of the 100 PHCs, only 30 PHCs had medical personnel who could take and read an ECG. And 100% of them were motivated to learn about on reading an ECG if deployed to their center. And when we actually went to the PHCs and interacted with the medical officers, we realized that how motivated they are for real, because we'd assume that if we ask them, if we give you something, would you be interested to use them? So we'd expect that obviously everyone would say yes. Who would say no? But when we actually reached out to the medical officers in the rural areas and talked to them, had conversations with them, we realized that those were medical officers just like us. They'd cleared their MBBS, and they were doing the MOship, and they really wanted to help the people there. And this was, not having ECG machine was a hurdle for their diagnosis. So they were more than happy to use the machine, and uh, it would be like a prized possession at all of those areas. Definitely, we cannot expect the 100% turnout, but we're sure that the turnout would be, in the higher range of 60s and 70s, which is huge. So that is the
Exactly.
plan for in the next
Yes,
6 months, we would be deploying over 250 ECG machines.
250 ECGs, and that would be completely donated by
Yes.
WYHF. Yes, that would be completely donated by WYHF. Okay, guys, so that's our plan. So, Priyansh, I want to ask you, in short, what is the vision 2030 of WYHF?
So Vision 2030 is mobilizing 30,000 young individuals and, impacting uh, over 3 million lives in by 2030. We've already managed to mobilize over, in just a year. We 8 years from almost 8 years from 2030, and we've already managed to mobilize over 1,500 to 2,000 people. So we're close to
Yes,
the 30,000 mark, and the 30,000 young individuals would belong to various fields across the world, and saving lives at the end of the day is the goal.
exactly. So, Priyansh, my next question is like being an entrepreneur, you must be facing some kind of challenges and obstacles. So, what are those, and how do you tackle them?
For sure. So I'd say every day is a challenge. Every day you come up with new challenges, with new problems. But answering it briefly, one solution which I'm sure would work for everyone is, Nike ka slogan, just do it. So
Yes, that's true.
we always keep planning. We, keep procrastinating that I'd like to do that, and this is how we do. But the reality is, you wouldn't understand unless you actually go on ground and, see what's going on and actually implement it. So whatever your idea is, whatever is going on in your head, pitch it to a few close friends who you think would give genuine answers, and they can straight away say, no, this is a bullshit idea, that won't work. And they would support you at the same time as well if it's an idea worth pursuing. So, and even if they say the idea is not worth it, and if you still have that gut feeling that it might work, then don't be afraid of all of those naysayers, and you can just go out and try it. So the plan is that 10 years from now, you shouldn't regret that you didn't try it. So I'd say that would be my number one tip for everyone. If you have an idea, go after it.
Yes, exactly.
So
So,
if I just give one example. So there was this survey for startups and the CEO of startups, and how they judged people whether the company would succeed or not is by just asking the CEOs about how motivated were they for their startup, and how to what extent would they go for their startup. So there were people who were all in, who had donated all, who I mean, who had put in all of their savings and everything in their startup, and usually those are the people who succeed. So unless you go all in, And this doesn't mean taking extremely risky decisions and blindly doing stuff, but it's just about taking calculated risks. And you have to be fully invested in what you're doing. You cannot
Exactly.
just, say, I want to try this and start doing it. And then 2 weeks from it, if it's not working out, you stop working on it. Uh, it takes a long time to get results, and you have to be patient once you try. So you just have to keep believing in yourself and your idea, and keep trying. Yeah.
Oh, definitely. Risk calculation is very important whenever you are coming up with an idea. Without risk calculation, do not execute at all. And I read somewhere, execution is the best reward to your idea. If you have an idea, execute it, whether it will succeed or fail, right? But with some certain extent of planning and risk calculation. Just don't go blind. Okay, yeah. So that's really nice. So I would like to ask you, what five management and entrepreneurship tips you want to give it to our audience, Priyans?
So five management and entrepreneurial tips that I give to the audience would be: one would be management. Managers is not the term, leader is the term. Work by inspiring people, by leading people, and not uh, pushing people and asking things. So whatever you uh, do it by leading it. You have to set an example that you yourself are doing something. So you're not expecting something crazy from the people that you're working with. So that is one tip. So you have to be mindful of everyone is the second thing, and you have to lead with example is the first thing. You have to be mindful of people is the second thing, which I was coming to. Is uh, right, especially in the past year, people have faced a lot of difficulties, and it's been extremely difficult for a lot of us. So you have to be mindful of the struggles that they're facing, the problems that they have, and you have to keep believing in your team. And most of the times it turns out well. So you cannot stop believing in your team, and you have to be helpful. Like wherever you can help them grow, you should take an extra step. You should go an extra mile to help them out at a personal level as well. Then the next tip would be that it's always hit and try. So don't expect your plan to work out beautifully in the very first time. It absolutely never happens like that. So it's always hit and try. So don't get disheartened when the plan that you've made, that you've worked on for months and months, fails straight away. You should just see how you can take it ahead and how you can improve it. So you just have to keep trying. So that would be the third tip: hit and try. Then again, this is related to hit and try, is the quote which says, delayed does not mean denied. A lot
Yes.
of time it happens that something that we've been rooting for. So a lot of you might have heard that whatever you want, ask the universe for it. That you just have to believe that that thing has already happened. You have to believe that this will surely happen to you. uh, and it is true.
Yeah.
It is true, but it doesn't always happen immediately. So you just have to understand that things can get a little delayed, but it doesn't mean that it's denied. And people would have different timelines. So you probably might get there in a few months, weeks, or years, but you will get there. And
Definitely.
yes, and I'd say the final tip for management and business is, uh, you know, again, something very common that you might have heard is customer is king in the business world, and experience is the queen. This is something which I just made up, but it makes sense. So what I mean to say by this is you, what you have to do is always go out there and ask for experience, ask for reviews whenever you're implementing a new idea. Don't be afraid of getting bad reviews, uh, because the sooner you get those bad reviews, the sooner you'll be able to improve on those areas. So unless you go to the customer or the target audience in case of an NGO, and unless you experience some hardships, you wouldn't grow. So you always have to take all of those perspectives in mind and modify your solution.
Yes, that's really nice and amazing tips, definitely. So I remember, guys, whenever we have our meetings or calls, is always energetic, full of enthusiasm, and always, how's the Joes wala thing? How's the Joes? Hi, sir. Always with high Joes. Whenever we meet over calls or over, meet in any meetings monthly, we have almost 4 to 5 meetings, and nowadays, though, I think every, last to last week we had every day, and our meetings were going up to 3 a.m. or 4 a.m. sometimes 3 a.m. sometimes 3:30 a.m. when we were planning for the ECG and research part, right? So it's really good to have a fellow like him. So I'll just ask the last question, Priyans. How our people can join our social drives, and even if they want to join WYHF.
For sure. So it's extremely easy. Anyone under the age of 35 years who connects with this idea, you don't necessarily have to have core cardiovascular health knowledge. You, there we have members, we have volunteers who've had a history of a cardiovascular event in their family, and they're motivated to work on it. So, irrespective of what your background is, there would be a fit in this organization. As we've mentioned, the five committees: health education, entrepreneurship, advocacy, research, and technology. There would be some place where which interests you, and you should be passionate about working on cardiovascular health. And I'm sure that you'll find a lot of like-minded people here in the organization who's striving every day to improve this. Uh, so the latest project that we'd be working on is the one which I described in detail, is strengthening the rural healthcare system by deploying the ECGs. So what you guys could do is uh, what you what you guys could do is uh, follow us on Instagram. We post all our updates there. You could become a member so that you regularly receive all the updates and get a chance to be a part of the team and work more actively in the organization. So I believe I could share, or Dr. Ajit could also share the membership details
Yes, yes, definitely.
on
We'll share in the
the
groups. Yeah.
links. So with those links, you can join in and you can help. So as I mentioned, for the ECG project, you don't necessarily have to know how to read an ECG. Uh, if you just connect with the idea of helping people in the rural areas to get a chance to live and maybe save their life from a heart condition, then that's it. You would be more than happy to be a part of the team. You can help in finding local donations. You can help in finding you going and talking to people. You can help in training, and
Yes.
you can do anything that you put your mind to it. Yeah.
Exactly. And the right word he said, the passion, passionate people, they don't look passionate candidates, individuals who are, passionate to learn, they don't look at the time. Seriously, guys, we all were engaged in our, daily work schedules, like in the hospitals, in the, our company work or, other works. And we usually started our meetings by 10:15 a.m., 10:30 a.m., or sorry, p.m., or sometimes 11 p.m. And our meetings used to continue to, morning 2:30. So we, when you are passionate to learn, or when you are passionate to, contribute to a good cause or to anything, you should not look at the time. Sometimes you have to, sacrifice your sleeps, but it really worth. Seriously, guys, it really worth. So whenever you want to learn, you should not look at the time, or you should not look like, okay, I will not work after 9. This is my sleep time, or this is my, entertainment time. Not at all. Whenever we have, time to learn, you should. Okay. So by this, I'll go to the questions. Priyansh, if you can answer the questions, there are some questions in.
Yes, yes.
Yes.
So the Aditya and Ranjani, they have kind of similar questions, so I could answer them in one go. And these are actually very valid questions. So it always starts with imagination and then to an idea. So here the thing is, always write things down. And this is not, it might sound a little old fashioned, but I prefer, even as Dr. Ajit showed his diary, even I
Yes.
prefer pen and paper. Because
Yes.
when you're actually writing, things start flowing. So
Yes.
whenever
True.
you're imagining something, whenever you have an idea, put it down on paper. Make a
Exactly.
plan on what you want to do, what you want to achieve. So in
Yes.
that, there's a thing called SMART objectives. So
Correct.
what that means is S stands for sustainable, M stands for measurable, A stands for achievable, R stands for reasonable, and T stands for time bound.
Time bound.
So whatever object, yes, whatever objectives or whatever plan that you set, it should be R was not reasonable, it was realistic, my bad. So they should be realistic, that you should be able to achieve them. Then they should be measurable, that for example, you say that you want to start a company for let's just say, if you want to start an online pharmacy, and it is possible now. So yes, it's realistic. Is it measurable? How can it be measurable? Is that you want to have at least 5 customers in the next 6 months. So that's again achievable and measurable. So the number is measurable, and achievable is that's something that you can do. And time
Yeah.
bound is when you say that you want to do it in the next 6 months. And sustainable is that, as I mentioned earlier, persistence is the key to everything. You cannot work on an idea. You cannot, a startup is not something that you just start and let go. So you
Yes.
have to invest, you have to be ready to invest a lot of time in it, time and energy in it. So write down these SMART objectives. You can also Google SMART objectives and you'd find a good guide on that as well. So work on that. Reach out to the honest and trustworthy friends for their, you know, genuine response. But this is more on the personal end. So your friends might just say that, dude, you're already doing so many things, you're already overburdened, and this might not work out so well, or you might not be able to give in the required time to make it a reality. So they can give you a personal angle. And if those friends also belong to the domain that you're working in, they can also give you a professional answer. But here, feel free to reach out to professionals. I would strongly recommend everyone to join LinkedIn and
Yes.
build your network on LinkedIn. And
True.
feel free to reach out to anyone. So, in the best thing about today's generation is you can literally, you're just a message away from anyone. And
Anyone.
what you'd notice is that a lot of people are happy to help. Again, when you reach out to some person with an idea, you have to have a proper pitch, you have to have a proper ask. So whenever you reach out to a person, you cannot just say that, so what do you think about my idea? You can say that, so this is what I'm planning to do, and this is how I think you might be interested in it, and can you help me for this particular task? Can you help me in let's say, see the strategy aspect of this, if you think this might work out? You have to be very specific with your ask when you reach out to professionals, so the chances of your response might increase.
Yeah.
So, and reach out to as many people as you can. There's
Yeah.
no limit. You reach out to 100 people, 2, 3, 5, 10 people might respond, but those 5, 10 people, might just help you take it to the next step. And you know things like incubation centers, financial assistance, and all of that definitely helps you to take it to the next step. But those are the things which have been over publicized. So you don't need a huge amount of money to start. So
Yes.
whatever you're doing, start off with a pilot. As you would have seen, all the projects that we're doing, everything that we're doing starts with a pilot. The pilot hardly requires any money, and if you're pitching it right, you can do it free of cost in most of the cases. So you don't, to make an idea, to turn an idea or a plan into a startup, you don't need a huge sum of money. Any small amount that you have accessible to you, you can start off with that. You can see how it's working, and that is the thing which will motivate other people to fund you, to take it to the next step, because then they'll say, how invested are you in this? You've put in your own money, you've put in your own blood and sweat in that. So that is what makes investors happy, that you're invested in this. So don't think that unless I get an incubation opportunity, or unless I win a startup competition, I might not be able to convert my idea into a reality. You just have to go for it. Start small, think big.
Yes. So
So
one more
that's
question.
those are the two questions. How do you remain motivated when working towards your passion? So you're not always motivated. There are times when you feel like, what am I doing? Why am I doing this? I want to stop everything and just run away. There are
Hmm.
times like that. So it's not always, the good part, that a lot of people would say that I wake up 5 a.m. in the morning, do yoga every day, meditate, exercise, and that keeps me happy every day. Those are the things that will definitely help you. uh, Having a clear idea in your head about what your final goal is, why you started, definitely will help you. So mainly about your passion, one of the biggest areas which keeps you motivated is this: taking a step back, thinking why you started that, why you are doing what you're doing, and why you want to continue doing what you're doing. So where do you see yourself in the future, and how will the thing that you're doing right now help you in the future? So these are a few questions that you ask yourself and answer as well, which will help you stay motivated. But we have to understand that we're just humans, we need days off. We need to maybe just sometimes stopping everything and just going outside, maybe relaxing with friends or going out on a small trip and refreshing your mind. You're just back with the same motivation. So just don't go after the hustle lifestyle which says that you have to keep working, and you cannot waste a second. That puts a lot of pressure on us. So don't, I'd say that is necessary, but it is not sustainable. So so it's like you take small sprints in the long marathon, but
Yes.
there's always rest in between. So yeah.
Correct. So one more thing, that's my personal theory, but I think I should share, guys. See, there is no time to sleep. People think like, if I sleep 4 o'clock, I'll get up 10 o'clock, then my day will be, like not start correctly, or I'll not start 6 a.m. or 5 a.m. It's up to you. If you have your work, if your work is going up to 3 a.m., it doesn't matter. Okay, you can wake up 8 o'clock or 9 o'clock. Don't make it a permanent schedule. But if you are sleeping 3 a.m., then your body also needs 7 hours rest or 6 hours rest. Okay, so it doesn't matter. It does not make any sense to get up again 6 a.m. Get up whenever your body says. 9 a.m., 10 a.m., 11 a.m., doesn't matter. Okay, so listen to your work and your body and maintain the balance. Okay. Yes. So thank you very much, guys, for joining. And thank you, Dr. Priyansh, for joining the Voice of the Youth Leadership Dialogues. And yep, thank you, guys. Thank you very much. Thank you, Priyansh. We'll see you then. See you, guys.
Thank you so much. You all were amazing.
Thank you
Bye.
guys.
Take care.
Thank you. Thank you, Brian. Bye. Take care, everyone.